about the high-yield facts that are going to show up on your exam regarding uppers, party drugs, tobacco, and gambling. First, we are going to discuss the uppers. This includes cocaine. So cocaine's mechanism of action is blocking the reuptake of dopamine, epinephrine, and norepinephrine. This stimulates the reward system. This is why cocaine is so addicting. And you might get asked, how long does it show up in the UDS? And it shows up on a urine drug screen for about 2 to 4 days before it's undetectable. As far as clinical presentation, intoxication is what you would expect with the upper that increases the sympathetic nervous system. It's euphoria, dilated pupils, increased blood pressure, tachycardia, and feeling like bugs are crawling on the skin. It can be very dangerous. There can be arrhythmias, myocardial infarction, seizures, respiratory depression. Intoxication can be pretty scary. However, withdrawal is not scary. Withdrawal is uncomfortable, but it's not life-threatening. So any substance, whatever the intoxication is, the withdrawal is the opposite. So this is malaise, fatigue, hunger, constricted pupils, and vivid dreams. They feel super lethargic because with intoxication, they have that sympathetic nervous system going. Now for management, for agitation, you want to treat with benzos. This is highly testable. Do not give beta blockers. And this is because they can worsen vasoconstriction, they can worsen an MI, make the hypertension worse. You want to stay away from beta blockers. If there's severe psychosis, because intoxication of cocaine can also cause psychosis, you can utilize antipsychotics such as Haldol until the psychosis is under control. Next of the uppers, we're going to talk about amphetamines. So classic amphetamines are the dextroamphetamine, which is prescribed by physicians, or methamphetamine, which can block the reuptake and facilitate release of dopamine and norepinephrine. So again, that increase in the dopamine can make this very addicting. Intoxication is similar to cocaine because they're both uppers, but it can last for longer. Symptoms include euphoria, bruxism, which is teeth grinding, and chest pain. Chronic use of meth also can result in meth mouth. It's accelerated tooth decay. Amphetamines can also cause rhabdo. An overdose can cause hyperthermia, muscle breakdown, and that leads to renal failure. So you want to get labs on people that are intoxicated with amphetamines or have overdosed on it to make sure you're catching it if their kidneys start to fail. PCP. PCP is very highly tested on exams. Test makers really love to quiz you on this. Clinical highlights include mechanism of NMDA glutamate receptor antagonist. It activates dopamine neurons. Intoxication includes rage, arrhythmia, dilated pupils, delusions, amnesia, nystagmus, excitation, skin dryness. The big ones to take away from this are the rage and the nystagmus. So they have rotary nystagmus, which can be vertical or horizontal. It is a hallmark for PCP. If you see this on the exam, just go ahead and click on PCP. The rage, the extreme violence, and the high pain tolerance also are clear signs that this is PCP. So look for rage, aggression, and nystagmus. Management and labs. So lab findings, they're going to have an elevated creatine kinase due to the muscle rigidity or rhabdo. And this is also high yield. It can be detected in a UDS for up to 8 days. Treatment is to minimize the sensory stimulation. You can use benzos to help calm them down, help with spasms, seizures. You can even use antipsychotics if there's severe aggression. For withdrawal, there's no formal syndrome, possible flashbacks, but that's about it. Next, we're going to discuss club drugs. So MDMA, or ecstasy, mechanism of action is increasing dopamine, norepinephrine, and serotonin. Remember serotonin, that's very important. Symptoms can be empathy, euphoria, they feel really good, but MDMA plus SSRIs can precipitate serotonin syndrome. So test question may talk about someone that's already taking an SSRI. They go to a party, then they end up with the symptoms of serotonin syndrome. They probably had MDMA. Next, we have LSD. So LSD is a 5-2H2A agonist, also serotonin. Autonomic activation increases heart rate, blood pressure, hemodriasis. It can cause very vivid hallucinations, and there is a psychosis risk, especially in patients that are already prone to psychosis. We're going to talk about cannabis first. So cannabis works on the cannabinoid receptors, and it inhibits adrenal cyclase. Intoxication includes conjunctival injection, the red eyes. That is a key sign for your exam. It also can increase appetite, cause dry mouth, and paranoia. Again, with every substance, withdrawal is the opposite of intoxication. So when they're withdrawing, they're going to have a loss of appetite and they're not going to feel that great. Chronic effects, it is associated with antimotivational syndrome. It also can be associated with cyclic vomiting syndrome, which is awful to have. So just stay away from chronic cannabis use. Detection, it can stay in the system for up to 4 weeks with heavy users. And that is due to adipose storage. Next, we're going to talk about nicotine. So nicotine, it is highly addictive via the dopamine system. Withdrawal can cause intense cravings, irritability, anxiety, increased appetite, and weight gain. Treatment can include Chantix, which is a partial nicotinic agonist, bupropion or Wellbutrin, which is an antidepressant that can be used for smoking cessation. And you can also use patches, gums, lozenges that have nicotine, but it's better than the person smoking, doing something that can cause lung cancer, COPD in the future. Next, we're going to talk about gambling disorder. It is a non-substance addiction. So it is persistent, recurrent, problematic gambling behavior caused by significant distress or impairment. Symptoms are very similar to other substance use disorders. So you need at least 4 in the past 12 months of preoccupation with gambling, needing increased amounts of money for excitement, restless or irritable when attempting to cut down, gambles when feeling distressed, chasing losses, likes to conceal involvement, relies on others for money. If it seems like it's disordered gambling, it probably is a gambling use disorder. So treatment is Gamblers Anonymous, a 12-step program, and it can also be CBT. CBT is almost always right on test questions. For more high-yield videos, click on the right. Otherwise, good luck on your exam.